from stomach pain lately? You must be not sure about what to do, right? Your family must be getting worried thinking it could be appendicitis. Your friends must be probably telling you to not to get worried about it because, it can be because of gastritis or it could be because of outside food consumption. So is it really important for you to have severe pain when it is appendicitis? So let's just check that out in this video. And in this video, I'm going to talk about what is appendicitis, what are the causes of appendicitis, and then what are the symptoms of appendicitis, and also the treatment for appendicitis. So now, before talking what is appendicitis, it's important for us to know what is appendix. So appendix is a finger-sized tube-shaped organ present in the right side of our belly, which is just attached to our large intestine. So every organ in our body has its significant function. Like when we talk about heart, it is the pumping organ. And when we are talking about kidney, it helps in excretion. And when we are talking about stomach, it helps in digestion. So what does this appendix do? Nothing. So basically, this is not known to have any significant function in our body. So hence it is often referred to as vestigial organ. So now, what happens when something like appendicitis happens, and then what is appendicitis now? So appendicitis is when this appendix gets swollen because of infection or because of obstruction. So now there are two types of appendicitis. So one is acute, that is quite sudden. And then one is chronic, which has been there for quite some time and also very rare. So now, how early do you have to get it checked? So if you get a sudden stomach pain, make sure you're getting it checked within 48 to 72 hours because it often leads to a condition called rupture. So this is when the appendix bursts when it has reached a particular limit. So when that happens, it is quite life-threatening. So when we are talking about appendicitis, it is also important for us to know the age group it presents in. So it is actually known to be irrespective of age, but still it is very commonly seen in the age group of 10 to 30 years. So now what are the symptoms of appendicitis? So initially, you tend to develop pain around your belly button, and then slowly it starts spreading over your entire belly area, or else it also spreads towards the right side of the lower part of your belly area. Sometimes it is also associated with 1 or 2 episodes of vomiting. So this pain gets worse when you're touching, when you're moving, when you're coughing, when you're trying to take deep breaths, and when you're also sneezing. So when children are particularly avoiding food, this should be correlated with the symptom which I talked about earlier, the stomach pain. So this often helps the physician in understanding if it is appendicitis. So now what are the other symptoms? So you also develop fever, and there's also pain while passing urine. And there's also loose stools or else constipation. So please note that whatever the symptoms I've discussed so far, it is not necessary for you to have all of the symptoms together. So, and note that I've mentioned a prime age in which appendicitis can usually present, that is from 10 to 30 years of age, right? But that doesn't mean it is not usually seen in other age groups also. And often few studies prove that extreme ages tend to hide the pain because of the tolerance to pain. And one more thing you have to remember is to not take painkillers when you are developing stomach pain, because pain is the most important factor that will help us understand if it is appendicitis. So painkillers tend to hide the pain, so which often leads to misdiagnosis. So now what causes appendicitis? So the exact reasons for appendicitis is still unknown, but then we may have a few common scenarios. So the first one being when a hardened stool blocks the opening of appendix. So this will lead to the stoppage of blood supply which is supposed to supply the organ, and then thereby leading to death of the appendix. The second one being when there is already existing infection inside the body, or else any infection around the digestive tract. It will often lead to the swelling of lymph nodes. So that will lead to settlement of mucus or pus inside the organ. So the other reasons being IBS, and also injuries or trauma or accidents, anything of that sort happening directly to the appendix, or else growth inside the appendix organ. So there you go. Now you must have got an idea on what causes appendicitis. So now going to diagnosis. So how do we diagnose if it is appendicitis? So most commonly the patients usually present with tenderness. That is, when you touch, you have a lot of pain around the belly button area and also towards the lower right side of your belly area. And you can also get a scan done, that is an ultrasound scan, so which shows us an image of the organs inside our body. And CT scan is also usually recommended. And if pregnant women, if not both USG and then CT, MRI is usually recommended in pregnant women. So apart from that, urine tests are also recommended because it helps us differentiate if it is urinary tract infection or else if it is appendicitis. And blood tests is usually recommended to know if there is any presence of infection. So now let's discuss the appendicitis treatment. So we decide the treatment for appendicitis based upon the pain severity. So if it is mild, moderate, we usually give you the supportive treatment, that is give you something for the pain, give you something for the fever, and also antibiotics to reduce the infection. So even after this, if the pain doesn't come down, then we go for a procedure called appendicectomy. This is usually done in cases of severe cases also. Right. So now what is appendicectomy? Appendicectomy is a surgery involving removal of the appendix from the body. So there are two types. So one is Olden but open type of appendicectomy. So this is still being followed in cases of ruptures. And it also involves a lot of complications, and it also requires you to stay for a period of more than 7 days because the infection is severe. So the second one is modern, that is laparoscopic appendicectomy. This is minimally invasive. So this is usually done with the help of a probe inserted inside the body, and then that's how the organ is taken out. So like I told, this is minimally invasive and the complications are usually lesser comparatively. And that doesn't require you to stay in the hospital for more than 2 days. So the recovery rate of this procedure is also excellent. And what do we ask you to do post-procedure? So we ask you to follow the course of antibiotics we give you, and we also ask you to take a lot of fiber-rich diet, which will help in passing the gas very freely. So note that this organ is vestigial as discussed before, that is, it doesn't possess any significant function. So removal of this organ doesn't mean that you cannot get back to normal life. So you can have a completely normal life even after the surgery. Hopefully this video was helpful, and if you tend to have any of the symptoms like I discussed earlier in this video, please feel free to reach out to me or else any other doctor on MFine.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.